access is really important. In the state of Nebraska, both physical therapy and orthopedics have direct access. And so I think it'd be great for the patients to know they never ever have to wonder. They just come in and have it checked out. No pain is too small, and there's nothing that we won't listen to.
Hello, everybody. I'm Becky Pearson with Pearson Physical Therapy, and I am joined today with Dr. Heber Crockett from New West Sports Medicine in Kearney, Nebraska. And thank you, Doc, for joining us. And how is everything down in Kearney today?
We're doing well. Yeah, just in clinic today, and everything is going well in Kearney.
Great. So for the people that are watching that don't know who you are, if you could give us a little background and tell us a little bit about Dr. Crockett.
Yeah, so I'm an orthopedic surgeon in Kearney, Nebraska, and I've been here since 1999. So I've been here about, I guess this is my 21st year, so it's gone quickly, and I'm surprised to even say that. But originally I'm from San Francisco, California, where I grew up, and a little bit, I grew up in Paris, France for a while as well, and spent some childhood in both Paris and San Francisco, and basically went to UCLA Medical School and then trained in New York City for orthopedics, and then did a fellowship with Dr. James Andrews in Birmingham, Alabama, and I've been in Kearney, Nebraska ever since.
I had no idea. I'm glad we're doing this call.
Great.
Yeah, so how did you decide to get into orthopedics? Why orthopedics and not another specialty medicine?
You know, I think both my father and grandfather are physicians, and they were both in family practice, and I really liked that. And I went into medical school thinking that was what I was going to do. Maybe delivering babies and doing general care. I thought I'll just follow in the footsteps of my father and grandfather. But I got in, and the orthopedics appealed to me, and I really liked the residents that were orthopedic surgeons. They seemed very happy. They were all athletic, and I played baseball and basketball at BYU when I was in college for BYU, and so I felt like I fit better with those residents. And the internal medicine residents, they seemed to be kind of like guys I would have hung out with in college, and so I thought, wow, this seems like a fun specialty. It has to do with sports. It has to do with surgeries that I like. Very few people are very sick, so it's a very happy specialty. You have healthy people that are injured, and healthy people get better, and it's really fun. And so I was drawn to it for those reasons. And the surgery itself was extremely interesting.
I feel like orthopedists are kind of the carpenters for the body. Like you guys go in there with your tools and you fix things, and I think that's why I got into physical therapy. Is it's more on the positive outcome end of it. You're, like you said, there aren't as many sick people per se, and so it is very rewarding to get people back to doing the things that they love to do. So wonderful.
I agree.
Yeah. So in central Nebraska, a lot of people, you're kind of the go-to guy for the shoulders. Would you say that is your specialty, or is there something that is maybe that you're more passionate about?
I think I'm probably best known for shoulder work that I do. I think we just went over 12,000 shoulder surgery I've done since I've been in Nebraska. So we've certainly done, I think, more than anyone in the state. But I do really like shoulders. I also do knees and elbows. So I do a lot of knees. In fact, we started a company that I founded here in Kearney in 2005 that was a ACL company to do ACL surgeries. And that company went from here to Phoenix, Arizona. And ultimately, we sold that company to Zimmer in 2015. And it was an ACL knee company all the way through. And then at the very end in that company that we started, we did move up into shoulders. So we created shoulder anchors. And John Wright, who's here in Kearney, and I founded that company. And so we're passionate about the shoulder. We're passionate about knees, elbows. I really do like them all. I think that shoulder surgery might be a little harder. And so I think that because I've done a lot of it, I think a lot of surgeons don't want to do as much of that. Although they're excellent surgeons in the state, lots of them, and that are excellent shoulder surgeons. So I'm one of them, and I do enjoy it, and that's, I guess, what I'm known most for. But happy to see any knee or elbow that you have too.
The device, the anchor that you designed for the ACL, is it real similar for the shoulder then, or is it the same kind of an anchor or different type of?
So the anchor is really different. So the ACL anchor is different. We still use it today. It's used in like 58 different countries. It's all over the world. And it ended up being a very valuable company. And we had a lot of shoulder anchors that we made, and we made some new kind of shoulder anchors, some that don't have any knots on them. And we had some that were made of pure suture. So we had a lot of really innovative ideas in that company. And so Zimmer liked it, as did some other companies, and so they bought it. And so I still use almost all the implants that we did in that company. I use in our surgeries today. We're on the patents on them, and there's always, as in every undertaking, it isn't just one person, but we would have an idea, then we had super intelligent engineers. Like there was a guy named Derek Harper who was extremely bright, and he would take an idea and say, that's a good idea, but let's turn it around this way, or let's change it and put it upside down, or and everything he did really made it better. And so you kind of lose any kind of arrogance that you might get about, hey, we had this great company and it went well, to the fact that, it took a lot of people, and it took a lot of smart people that would each contribute. And so I was a small part of that. And it was just a spectacular process. And it allows you to be creative in medicine just as well as just seeing patients doing surgery. It allows kind of a more artistic side to kind of express yourself through thought and through creation. And we probably have 11 or 12 companies like that right now that are out there in and out of orthopedics. We're in the renal space, we're in dermatology, we're in, if you've heard of the company Kinza that makes the thermometers, that's a company that we're also heavily involved in. They're the ones that are mapping the whole US with COVID. And that's a company that didn't start here, but the founders were out here in Kearney talking about that long before it was on the front page of all the papers nowadays, mapping and getting ahead of the CDC and knowing where COVID is. So it's exciting stuff, and there's a lot of really, really interesting companies that we've been involved with that have kind of come through Kearney and Nebraska, for that matter. So we're excited about that. There's a lot of fun stuff out there that's outside of orthopedics.
Well, I think that would help just keep things interesting and challenging for you, for sure.
Absolutely.
So, yeah, speaking of COVID, right now we are recording this during COVID-19, and all of the elective surgeries are being postponed. What are your feelings about people doing prehab or rehab before surgery during this time?
Well, as you know, I don't do any surgeries unless people have complete range of motion. So that's why I send so many of my patients to you, and I'll say, look, get their range of motion, and to physical therapists all over the state. We need perfect range of motion, even if their cuff is torn, even if they have other issues, specifically if they have adhesive capsulitis. We need to get all of that so the motion is perfect. So when we go in to fix their shoulder, they have come in with perfect motion, which we're going to try to get back after we fix the shoulder. So it's super important, and the physical therapy part of it, and you know me well enough to know how much I care about physical therapy. So it's as important as the surgery, and it's as important as the attitude of the patient. So those three things, the attitude of the patient, the surgery itself, and physical therapy, are the three pillars, I think, in how people do.
Dr. Crockett, I appreciate you being very straightforward with what you expect from a physical therapist when we rehab your patient. But what would you say to a patient about what they should expect from their physical therapy treatments?
I think I think people will have pain after shoulder surgery. So I think that's a realistic fear. And if people are afraid of that, certainly they need to know that they will have some pain. I think in general that it's less pain than people expect. I think people come in thinking it's going to be almost insurmountable, and I don't think that's true. I think that oftentimes I hear much more often, wow, I expected this to be a lot worse than it was. And patients will tell me, I didn't take any pain medicine at all. I did not expect that. The physical therapy, the same thing. They think the physical therapy is going to be horrible, and the physical therapy is actually very good, and they end up liking their therapists and doing well with their therapists. So I would say that it's the rare exception that the shoulder surgery pain or physical therapy is more than the patient thought. I think it's almost always less, and part of it has to do with surgical techniques. It has to do with having an arthroscopic surgery rather than open. It has to do with physical therapy techniques being better. It has to do with the speed of the surgery with which it gets done. So I think a very good, quick surgery, and then physical therapists that know exactly what they're doing, and starting at the pace that we would like them to and working with us closely. It's been a very good marriage. And I think our patients have done extremely well.
What advice would you have in general for people to improve their joint health overall to avoid joint pain?
I think a good stretching and strengthening program at the baseline would be key. Something to keep flexibility, whether it's yoga, whether it's physical therapy, something to keep the joints moving, and then to lay down a certain amount of baseline strength. So, high repetition, kind of lightweight lifting regimens are good. I think as we all know, if we carry extra weight, it's hard on our bodies. So to try to be at our ideal weight is good. It's easier said than done. I certainly know that I'm too heavy, but I'm definitely kind of working on getting down to where I want to be. So I think people that do that, their joint health is pretty remarkable if they can keep their weight down and they can keep baseline strength. And weirdly, I know this might come as a shock, but I've been treating a lot of patients now more with diet. I have a lot of my patients that, I know it sounds like I'm way outside my lane, but it has been unusual for me. We have a lot of patients that have changed their diets dramatically, and the results have just been unbelievable. And I've just been doing that the past year, partly because I've done it myself, and I just said, wow, like the amount of pain I have is so much less, and I've lost a significant amount of weight. And I'm just like, wow, this is really, I could really tell patients about this, and they can see it. They say, wow, you're a lot thinner. And so for me, it's actually been really good. And so I've just told them a little bit about kind of my thoughts on that. And so I think all of those things matter, but I think keeping your weight down, staying at baseline strength, keeping flexibility, keeping joints in motion is always important. And physical therapy and the execution of kind of medical advice, I think can really go a long way in helping people. When do people know when to come in to see an orthopedic surgeon? And I would say that a lot of people don't know they can come directly to an orthopedic surgeon. They don't need a referral. Most people think they need to be referred, just like the physical therapy, like they can go directly to physical therapists. And they just need to understand that, I think for both of us, for both physical therapists and orthopedic surgeons, that they can just come directly to the clinics. They don't need to ask their family doctor for permission. And I think that's the most helpful thing. If they have shoulder pain, they can come right to me anytime. And if they have knee pain, they can come right to me, or elbow. I would always be available. Now, it doesn't have to be me. It could be any orthopedic surgeon, but they don't have to wait, or they don't have to ask permission from anyone, because we're considered primary care. Just like I think they can go to you anytime as well, to any physical therapy office. And I think it's a very good thing. I know our physical therapists see people primarily, and it works out really well. And then if they think they need to see us, they do, but they certainly can come to either one. So I think access is really important. In the state of Nebraska, both physical therapy and orthopedics have direct access. And so I think it'd be great for the patients to know they never ever have to wonder. They just come in and have it checked out. No pain is too small, and there's nothing that we won't listen to. We're absolutely not saying don't see your primary care physician for anything else. But if you have a shoulder issue and you're like, I just know it's a shoulder issue, I know it's a knee issue and my knee's hurting, then they don't need to necessarily go to the family therapist, the family doctor, and necessarily say, oh, I need permission to go. They can't just come straight for that. We're never going to replace a family physician. Again, my dad and grandpa were family physicians. I know the difference, and they know a lot of stuff that I don't know, and a tremendous amount, actually. So I would be a horrible family physician to come to. But if it's just shoulder pain or knee pain, I probably will do fine there.
Okay. Well, I won't keep you any longer. I really appreciate you doing this sit down with me, and I hope your family stays well. And
thank you. Yours too. It's been a pleasure talking to you. Thank you so much for the opportunity.
All right, great. Have a great day, Doc.
Thank you, Becky. Talk to you soon. Bye-bye.
All right.